terms of evidence-based medicine that there's any substantial or good level of evidence to say that mammograms cause cancer. So I definitely think that's a myth that needs to be debunked. I think screening with the mammogram has picked up a lot of early stage breast cancers, and inevitably the earlier the stage of the breast cancer, the better the chance of the survival and the better the chance to do well. So I'm obviously very pro mammograms because I see lots of patients who do have screening detected breast cancers, and it's really always the best scenario when we catch it when it's really small or really early. I mean, by the time that you can actually feel a breast cancer, it's already the size of probably a small marble, and by that time, even that early already, you can have spread to lymph nodes as well. So I think the earlier you catch it, always the better. So I think that there mustn't be a fear about doing mammograms. I know other things also that I hear is that patients complain because it's uncomfortable and the breast gets squashed. I think it's quick and I think it's life-saving. So I definitely don't agree with that statement. I always tell patients that treatment is very individualized because every single woman that we see essentially almost has a different type of breast cancer. How we decide on treatments is what I like to call we look at the personality of the cancer. So the most important things that we look at is something called estrogen and progesterone receptors, which are your hormone receptors, because breast cancers can use your hormones for food. And then we look at something called HER2, which is a protein that we find in women, and if it's overexpressed can cause a breast cancer. And then we also look at something called a Ki-67, which is a growth or proliferation rate that tells us how fast or how slow the breast cancer grows. And you can have very many different variations of this. You can have estrogen or hormone receptor positive breast cancer that's HER2 negative, or you can have HER2 positive breast cancers. And basically each treatment is decided on these factors and not necessarily on the size of the cancer or if there's a lymph node positive and those kind of things. In general, if we have hormone receptor positive breast cancers with low Ki-67s or low growth rates, those ones generally we treat just with hormonal therapy or hormone blocking therapy. And if we have HER2 positive breast cancers, then often we use combinations of chemotherapy with a targeted drug called Herceptin that blocks the HER2 abnormality. So what's important is that not every single patient will receive chemotherapy, not every single patient will receive hormone therapy, and really the treatments are tailored in according to the receptors and what we see when we get a biopsy or a histology report. The thing that I can emphasize the most, I think, regarding this is that don't ever be rushed into making a decision when you have breast cancer. Don't ever be rushed where a surgeon says that it's an emergency. There's no such thing as emergency operations or emergency mastectomies, or there's no such thing as every single breast cancer needs chemotherapy. I think it's always important to take a good informed decision, get good opinions. And also for us, every single breast cancer is discussed in a multidisciplinary setting. And what that means is that we have meetings every single week. We oncologists, breast surgeons, radiation oncologists, pathologists get together. We discuss the cases, look at the histology, look at the pictures on the mammogram. And as a team, we decide what is the best route and the best treatment for patients. And it's very important to make sure and encourage patients that when you get an opinion about breast cancer, that it's done by people that are experienced in treating breast cancer, and also that it's discussed in a multidisciplinary setting so that they can always be sure that they get the correct treatment. I think that when I meet patients for the first time, when they just get their diagnosis, I always joke, and I think me and you have had a joke about this as well, where I say, that you at your craziest, you're completely anxious, you don't know what's happening, so I say often patients' personalities and how nice they are actually comes out later when we finished all the treatments and all the anxiety is gone. But initially, I think what makes the treatment and the process and the journey easy is information. So I think patients must always ask questions, ask the oncologist to explain what the journey is about, what their prognostic factors are. They need to also understand with their treating doctor what's going to happen, what the road ahead is about, what type of treatments, side effects. So the more information I find that I give to patients, the more they calm down and they relax, because like you said, it's the fear of the unknown. So you're freaking out because you think you might die, you think that you're going to lose a breast, there's all these crazy things that go through your head. So I think once you've got information and you know exactly what the plan is, what's going to happen, what the journey entails, and most importantly that you've got the support of your oncologist and the support of the team at the center you're getting treated, I think that's what makes it a lot easier. And also, not in a scientific way, but I do think that positivity, being hopeful, being accepting your diagnosis and knowing that, yes, you're going to have to do treatment, and it's not always the nicest treatment if you have to get chemotherapy, but acceptance really helps it. And also when it's a curative breast cancer, knowing that, the treatments don't last forever, it has to come to an end. And generally what we want for you is just to have the best treatment up front so that we can have the best long-term outcome. The best way, okay, so firstly I want to say that patients with cancer must never ever blame themselves. It's nothing they did, it's nothing they ate, it's nothing wrong that they did. It's a multitude of factors that put you at risk for breast cancer. So being a woman and having breasts, your risk is already 12% in your lifetime, and as you get older that risk increases. And then different things such as genetics and family history, those hormone replacement therapy, taking that for a long time, those then increase your risk to get a breast cancer. Not all breast cancers are genetic or inherited cancers. Those cancers, referring to genetic cancers specifically, is ones that are maybe associated with a gene that's passed down in the family, such as the BRCA gene, which is your Angelina Jolie gene. We always refer to it because she tested positive and then had the mastectomies. But there's also some other genes, such as ATM genes, that can put you at high risk for it. Your oncologist will always take your history and advise you whether it's advisable or not to do genetic testing. And basically how cancer develops, the easiest way to understand it is that it's like being in a car and you've got brakes and you've got an accelerator. And when you've got a cell in your body regulates the growth of that cell by either pressing the brakes a little bit or accelerating, but it's a good balance. Then an abnormality happens, like a mutation or an abnormal gene. It's like when your car gets hit and then you press too much acceleration and that your cancer grows. Or if your brakes don't function, then your cancer also grows. So it's usually just an abnormality in the regulatory process of the growth and stopping the growth of cells. So, and why that happens, we don't always know. Some people have oncogenes, which are accelerators and cause breast cancer to grow more quickly. Some people have bad brakes, if I can put it that way. But yeah, so there's many different reasons, and I think the important thing to remember is that it can occur in any patient. And I've got patients that are very healthy and they run comrades marathons and they still get a breast cancer. And sometimes it's just unfortunate that even if you do everything right, you could still develop a breast cancer. So my advice is just for everyone to always do self-checks, to go for the screening, and just to have a general awareness of it. And I think the other thing also is that breast cancer patients, they're not a certain type of patient. So it's not a lot of old ladies walking around with breast lumps. And I mean, Marisa, you young and And I mean, it happened to you as well. I mean, that's probably the last thing you ever expected. And it's just, I see a lot of young patients as well. So I think all women, regardless of their age, should be checking, should be screening, and should just be aware that it's all of us. It's me, it's you, and it could happen to anybody.
Dr. Ronwyn, thank you so very much. Is there anything else that you would like to tell the viewers before we end our conversation?
I just want to say that being diagnosed with the breast cancer is not a death sentence. We have a lot of new therapies, even in patients with metastatic breast cancer or breast cancer that's spread. We've got so many new drugs, we've got new innovations. Breast cancer is probably one of the most researched cancers in the world, and always to realize there's always hope, there's always new treatments, to be aware that if you've got a breast cancer, to look out for clinical trials. At our unit, we've got a lot of clinical trials also for breast cancer patients, that you can sometimes get your treatment that way, and never just to settle, at your first your first consultation. If something makes you feel uneasy about the treatment that's been recommended, always get a second opinion, always trust your instinct. And so just to be really aware of everything and to just be positive, because breast cancer's revolutionized over the past couple of years. There's so many things we can do. Also to remember to, regarding surgery, that there are breast cancer surgeons or breast surgeons that just do specifically breast type of surgery, and always to look for those people that have a lot of experience. And there's also, in terms of cosmesis, and even though it sounds trivial to talk about cosmetic outcomes and how your breast looks, that there's people out there that work specifically just with breast, work with plastic surgeons, so that you still feel good about yourself and you feel confident even though you've had treatment and operations.